on to Paul Moulton of Isle of Man Television. Good afternoon, Paul. Faster Mai.
Good afternoon. I want to make sure I got this right. Friday, a teacher proved positive. It was announced on Saturday. At that point over the weekend, the Kent variant was identified, I think. But help me out on this timeline, because on Monday, again, that's the question I asked at the time. Schools were going back to school except for certain classes, when clearly if it was identified at that stage, we should have had all classes cancelled, all schools stopped. You said going in hard and fast was your policy, and it hasn't been that way. This is a bullet that we could have dodged, is it not?
Right, I'll ask Alex to tell you about that, Alex.
Certainly, Chief Minister. You're slightly incorrect, Paul. I mean, what we've been clear on doing from the Department of Education, Sport and Culture's point of view and the entire government's point of view is reacting to evidence and data. On Friday night, we did identify somebody who works in a school as being a positive case. However, they don't work in the school during the school time. They work out of hours. They were contact traced, and it was judged that they were not in contact with any children at the school during that time, and that was classed as low risk. Furthermore, because that was on a Friday, we've then gone 72 hours with that school. The head teacher was alerted, I understand. We put in measures to reassess the risk for that school on Monday morning. And again, there was not seen to be a significant risk to close that school down. So to put the chronology right, again, we've got cases of coronavirus coming into the school rather than necessarily the school being a source of infection. The reason we had to take decisive action last night was that had changed, that now the concern was that people were actually going into schools that were open, and there was the risk that they would get the infection there and bring it out into the community. And so that was the change last night that unfortunately made us take this decisive action to close down the childcare and education service.
Let me just put this in. Do you regret not shutting schools on Monday?
What we did on Monday is make a good assessment of the risk involved. When we found that a case of a child who'd attended school on Monday evening after the school had shut, we closed schools down the next day in a phased approach that had been agreed with the teachers and which is the right way of doing it. Last night was different because of the real and present concern that we had widespread cases through a whole range of locations, and that's why we had to act an awful lot quicker last night than we did on Monday night.
Okay, my second question. Gary Roberts, Chief Constable, isn't one for doing interviews and saying things unless he actually, I think, has to. He's broken ranks, I believe, here to say that there's a major problem in the police force. They've got lots of people off, and I've had many calls myself about this a day. This is frontline workers. Once the steam packet were allowed to have jabs, you've opened up that door surely to allow bus drivers, taxi drivers, the police, ambulance, whatever, the chance to have that dosage now. And if I can suggest, donate a dose might come in fashionable if it's even possible. Some person may not want to take their dose, but donate it to a police officer. Is that something to think about?
No, I'll bring in others on this one too, Paul, but I think it's important to say that the vaccine will, if we were to vaccinate all the people based on the island who do our emergency services ahead of our more vulnerable, we would not stop them necessarily getting COVID-19. We wouldn't stop them necessarily spreading it on COVID-19. They would have to isolate. The reason was that we gave it to the steam packet is that they were mixing with people who were on and off from the United Kingdom, the different crew, and we were concerned about the resilience there. So obviously, if a policeman or police lady or a nurse or a doctor, if they have meet the criteria to have already had a vaccine, then they will get it. We are moving quickly through our vaccination process now, and we hope with the extra 10,000 vaccines and 1,000 a day that we can quickly give the support to all of our emergency services. But it has to be remembered that the vaccine is there to protect the life of the individual who is really at risk of potentially dying or getting seriously ill from COVID-19. I don't know, David, if you'd like to expand on that, and maybe Dr. Hewitt.
Yes, thank you, Chief Minister. This goes back to what we discussed at yesterday's briefing, Paul, around the way the vaccine programme is set up. The vaccine programme is not based on someone's likelihood of contracting COVID-19. It is based on their vulnerability should they contract it. So the priority groups are around those who are most likely to become seriously ill or die from COVID. And it is important we stick to that. It's not possible for people to donate a dose. If people can't do that, the dose is for them because they have been prioritised according to their needs, either be it age vulnerability or medical vulnerability. Now, in terms of resilience in workplaces, the vaccine doesn't assist with that because, as the Chief Minister has said, the vaccine protects the person from becoming seriously ill, but it does not stop them contracting COVID-19. And although there is very welcome news coming out of studies that it reduces transmission, it does not remove transmission. So, for instance, if we use the police scenario, even if you had the entire police force vaccinated, they can still contract COVID-19. And were they to contract it, they would still have to isolate. So we're in the same way as people do now. So it does not actually help with the resilience of the police force, having the police force vaccinated. If there are officers that have underlying medical conditions or by nature of their age are vulnerable to COVID-19, they will be prioritised for vaccination because they fall within the vulnerable groups. And that's the same across all key worker groups. And I'll bring in the Director of Public Health in case she's got anything she would like to add.
Thank you, Minister. That was very comprehensive and very well explained, and I don't have anything that I can usefully add. Thank you.
Well, let me just come back quickly. The Chief Constable does not do that lightly, going into the public domain. He's got no officers, potentially, in a few weeks' time. You're asking the police to police without any policemen, if that makes any sense. You understand? They're the frontline people to make these laws that you're bringing in to be obeyed. And they clearly have got an issue with staffing numbers at the minute.
Yeah, absolutely, and I share the Chief Constable's concerns, Paul. It'll be the same with the fire brigade, with the ambulance service, the prison service, and other areas. This is a serious threat to the island, and we will do our best to give what support we can to the police force. But we've not seen any evidence that by vaccinating them now, we will stop the reduction in officers having to isolate. It's a dreadful position to be in. I understand the Chief Constable's concerns. He's quite right to be very concerned about his workforce and looking after their interests. And if we thought there was something that we could do from a vaccination point that would help solve the situation, then of course we would do our best to look after our hard-working police service who are at the front line. But as the Health Minister has clearly stated, that won't stop them from catching it, and they would still have to isolate. But share your concern. I know, David, if you want to have a final say on this.
Yes, if I can, Chief Minister, I'll keep it very, very brief. But I think, Paul, what we're talking about there in terms of pressures of staffing, and it is a concern. I share the Chief Constable's concerns on that as well. We've got similar concerns in health. The answer to that isn't necessarily vaccination. The answer to that may be testing pathways, where people, as we've done with other groups of workers, can potentially come out of isolation earlier if they have certain mitigations of testing pathways. And if we end up with key services under pressure, that's the sort of route that I think we need to look at. It's not vaccine that will actually fix that. It's potentially testing pathways.
So you're going to offer that service to the police and the fire brigade and whatever if they need it?
Well, like I say, if required, we would have to speak to them and we would have to work up a solution. We similarly will have to do so in health if the resilience, for whatever reason, comes under pressure. But there has always been the ability for us to look at testing pathways. We use testing pathways for various groups of key workers, which allows them to go to work and then back into isolation at the home after they've completed their job, and we would have to look to see what we could put in place to ensure services keep running.